Good morning, everybody, and welcome back to your Lunch Break Live. My name's Ivana Herenque if you're new here, and if you're not, thank you for coming back. Today is Tuesday, March the 22nd, and today we are talking about the Black Belt, and specifically how the Black Belt region was hit the hardest by COVID-19. Today, I am joined by two graduate assistants at the University of Alabama who work with the University of Alabama Education Policy Center. This is Garrett Till and Emily Grace Corley, and today we are going to talk a little bit about a report that they co-authored about the Black Belt being one of the hardest hit areas by the COVID-19 pandemic. Now, again, this might not surprise some people that this area, one of the poorest in the nation and one of the ruralest as well, was hit so hard by the pandemic, but it might surprise you why. So Garrett, Emily, Grace, thank you for joining me today to talk a little bit about this report. And I think first, before we get into some of the details, Emily Grace, why don't you tell me just kind of the general idea of this report and the general thing that you found?
Yeah, so we looked at COVID death rates both in 2020, 2021, and overall, and we found that in 2020, the Black Belt was hit the hardest by far. In 2021, it kind of evened out. It was still hit hard, but non-Black Belt counties were hit almost equally as hard. And one of the reasons that we kind of present as a possibility or a possible explanation is that the Black Belt was more vaccinated than the non-Black Belt. I think 7 of the 10 highest vaccinated counties in Alabama were in the Black Belt. And we kind of think that that's because they're generally older. They would have had more access to the vaccine early on. And also the state had actually did a really good job of targeting rural Alabama and the Black Belt for these mass vaccination sites. But then one of the other explanations that we found for why the Black Belt was hit so hard was just the lack of healthcare access in general. I think most everybody's familiar with the fact that the Black Belt has very few hospitals, and the ones they do are in danger of closing. And then on top of that, we also found that the Black Belt has really low numbers of just primary care physicians. I think with Montgomery, they have about 17 primary care physicians per county in the Black Belt. But without Montgomery, most Black Belt counties have on average 8 primary care physicians in each county, compared to a place like Jefferson County, Shelby County that has upwards of 300. So there's just insane healthcare access disparities that contributed to that.
Well, and you mentioned that number that without the Montgomery area and without the county there, that most of these Black Belt counties have an average of 8 primary care providers. And that is a number that I think will be surprising to a lot of people. I mean, I'm in Jefferson County, and pretty much every region you go, at least anywhere with a hospital, you've got probably 8 on one floor. Right. And that is not 8 per county is just very hard to imagine. And even those that you do have in these Black Belt counties, they're so rural and there is no widespread public transportation. So if you don't have a vehicle, it's hard to get to that provider. Garrett, tell me a little bit more about that. And Emily Grace mentioned that the pandemic really hit the Black Belt the hardest early on in 2020. So does that lack of healthcare play into why the Black Belt was hit so hard so quickly?
Well, I guess infrastructure is, in fact, a great problem whenever it comes to the Black Belt being hit hard, not only in that the lack of healthcare professionals, but also by the fact that you can be out in the middle of rural Butler County, Alabama, and if you have some sort of reaction or if you have some symptoms of COVID, it's going to be sometimes between 30 and 45 minutes before you can get a ride to the nearest hospital, whether that be a regional one in Greenville or upwards of an hour to get out to Jackson and Montgomery, maybe even down to south if you're over in Washington County, Alabama. Yeah, it's just because it's hard to get around those county roads. And so that's just one contributing factor, as well as just the pipeline of workers and skilled workers that go to these major metropolitan areas. And whenever they do come back, it acts as a super spreader almost, though. You know, you have these pipelines, people from these rural parts of Alabama just going in and out of these metro areas to work and coming back, and then it's just easier to spread from the concentration of people in those areas.
Well, and let me ask you as well, Garrett, the beginning of this pandemic, there was information that was changing so rapidly, right? We were hearing one thing one day, and the next day it was changed, not because of anybody necessarily being wrong, but just because we were still learning about this, right? So we thought one day we needed to wear gloves and wipe everything down and make sure that we weren't touching things. The next day we thought, oh, well, it's not really as transmissible through anything that we're touching or putting in our mouth. It's an airborne situation. So with all of this changing information, in 2020, at the beginning of this pandemic, was the black belt also hit harder because there's a lack of access to broadband? There's a lack of access to places where people can get up to date information?
Oh, surely, yes. Broadband does play a major role in the black belt being hit, not only because, as you mentioned, not being able to keep up with the current protocols and guidelines being put in place, or even be it through not being able to receive the proper health education aside from the guidelines. Let's say you want to just talk to your doctor, you don't want to go to the hospital in, that very high risk area, especially at the start of COVID, as we all knew, if you're afraid to go to the doctor at that point because you're afraid you're just going to hear the worst. So broadband access limits any sort of telehealth options. So you're not able to just, talk to your doctor, get some concerns off your chest, be advised just to take your vitamins, simple stuff like that. So yeah, broadband access, it plays a huge role into just the many things that affect the black belt, whether it be poverty, whether it be training, whether it be healthcare, a variety of yeah.
Well, and we saw too when there was I know Emily Grace, you mentioned that they had a very high vaccination rate here in the Black Belt, and which I think might surprise a lot of people again because that broadband issue. But you look at, say, when the vaccines were starting to become more widely available, 2021, the Alabama Department of Public Health and other locations that were offering the vaccine, again, not necessarily by fault of people, but just because of a lack of a plan here, most of that was done online. They had said, look, go to this website to book your appointment for your vaccine. But what if you don't have a computer? What if you don't have internet access? If you call this number, you might be on hold for 8 hours. And we saw a lot of people run into that problem. So did you see any of that going on in the Black Belt that you studied?
That's not something that we specifically looked at, as far as, like, um, how did these people find out about the vaccination sites? I know I am aware of, I think there were a few federal, vaccination sites that were, like, run by the National Guard, or I guess the state National Guard, um, and so I think one of the other things that, Alabama did really well was have that non-broadband, community outreach. There were a lot of posters around town. I know UA, professors did a study on one of the vaccination campaigns, and, they did a lot of, community outreach that wasn't gone like, funneled through the internet, to kinda get around some of those issues.
And I guess I just want to
Something
add
that,
on to that. Oh, I'm sorry. Uh,
no,
I
go
was just
ahead.
I was just going to say a lot of the times whenever we were going through some of this data, be it vaccination rates, be it the effect of broadband access, uh, while I was looking at it, I was trying to translate that over to my own experiences. Again, I'll keep bringing it up just because, but I'm from Greenville, Alabama, in Butler County. And one of the biggest things was trying to get an appointment to get tested for COVID, or especially early on, whenever everyone was. And you have to go in, you have to call, you're going to be on hold for 30, 45 minutes at times. Because, I mean, everyone relies on satellite internet, so that's not really an option at most areas. And then once you're able to finally get a hold, you go in, you get your test. They're not able to, they don't have the resources to translate those tests on site. So they have to send them out to different clinics and different testing facilities in Montgomery County, which is already a 45-minute to an hour drive. And so it's going to be almost an entire work week before you're able to hear if you're positive or negative. And then it comes back that you're positive. Well, you've been going to work all week because, you don't know yet. And at that time, there's really no guidelines or rules put into place about skipping work if you were exposed or if you got tested or not. So yeah, that does just exaggerate the COVID problem, especially early on in the Black Belt, as we saw with those COVID 2020 numbers.
That's a really good point too, and good just kind of being able to experience that. It's a good thing that you were able to experience that before you did this research. So you could say, "Oh, I remember that because it happened to me." So I want to move into some of these numbers. I've got them written down in front of me, and I'm going to look at them, make sure I get them right. But your report found that 6 of the 7 Alabama counties with the highest death rate were in the Black Belt. Again, that's 6 out of the 7 Alabama counties with the highest death rate. And you also found that in the 25 county region that the Education Policy Center defined as the Black Belt, we'll pull up a map in a minute, that 700,000 people are in that region. Okay. That death rate in those counties is 413 deaths per 100,000 people. Now, compared to non-Black Belt counties, the other amount of counties in Alabama that are not in that 25 group region is 355. So that's a pretty big difference of 355 to 413 per 100,000 people. Emily Grace, tell me a little bit about that.
Yeah, so when we were researching this, we did, we went through and we broke down county by county the death rates per 100,000 people, and it's a really big difference. When you look at the Black Belt, they've got these much higher death rates versus the lower non-Black Belt death rates, and something like on top of that is that in 2021, when you see the death rates even out just a little bit, the non-Black Belt counties catching up to the Black Belt counties in death rates, it's not so much the metro areas, because non-Black Belt counties include places like Jefferson, Shelby, and the Birmingham area, Tuscaloosa, Mobile, Huntsville. Those counties are not typically hit as hard as far as death rates, and that goes back to healthcare access, broadband. But in 2021, when those death rates even out just a little bit, it's mostly rural Alabama. So it's a Black Belt problem. The Black Belt is hit the hardest. But when you consider just non-Black Belt rural counties, it's a very similar problem across rural Alabama. And it's the Black Belt, but it's also a larger rural Alabama problem.
And Garrett, can you tell us a little bit about why that is? I think people see these numbers or they read these numbers and they say, look, there is not nearly the amount of population in the Black Belt region or in this rural Alabama region as there are in some of these more urban centers. Why is their death rate so high? Why are they dying so much quicker than other people?
Now, there are a number of factors here. After we've talked with a couple of healthcare professionals throughout the Black Belt, most relevantly with Miss Wilson over at Hill Hospital, she was just able to tell us that even before COVID, the Black Belt was not the most healthy. There are a lot of underlying factors that are very common killers in the Black Belt, stuff like diabetes and like diseases. And her biggest thing was just like how COVID is just going to compound on top of these underlying conditions. And not only that, but also just how healthcare in rural Alabama is going to just have to revolve around stabilizing patients and just having the infrastructure necessary to try and transport them as quickly as possible to Montgomery or to your Birmingham or to your Mobile as quickly as possible. And then just another reason is that, like I mentioned before, though, with this pipeline of workers going to and from the Black Belt is just another way for COVID and other disease, bacteria, whatever, to come back to the Black Belt and then just slowly spread in its own little way. I mean, sure, you have your hubs in non-Black Belt counties, but whenever you come back to these small little areas, people, while they are fairly spread apart, they're fairly isolated. People do find ways to get together.
And it's interesting that you note that those kind of counties that are on the edges, right? So I want to pull up a map here. Give me just a second to get it together. And this was one that our own Ramsey Archibald created when he wrote actually about the report that your team made here. So let me get this pulled up. And this really shows the death rates before vaccinations were widely available versus after. And not only does it show that, it shows the rates of death here via color coding. So it's easy to look at and see. So let me get that pulled up here. And if my computer will cooperate, which we know is a working from home problem that I think we have all had at some point. So we'll get this pulled up and you can see again, the darker the green, the more death rates for per capita than before vaccines. Let's see, let me get this pulled up here before I talk and read at the same time. Here we go. I'm going to pull off of this this banner so it's easier to see here. And then I wanted to get a little bit more of what you were saying, Garrett, about these edges that are darker. Now I'm going to toggle over to after vaccines. And this is what I think is really interesting. Now this black line outlines what, again, the UA Education Policy Center has defined as the black belt. Okay, that's what that outline is. But you look at some of these counties, specifically at Conecuh County, and you see this after vaccine death rate per 100,000 people is 327.7. That is very high, and that's higher than it was before the vaccine. Why is that?
Could you move that cursor over for a second so we don't see the Conecuh County stats right there?
Yep.
But I was just going to say, yeah, whenever it comes to, especially Conecuh County, if you were to flip between either of those maps, you're going to see some very similar things where we're going to see Montgomery County with a very lighter shade compared to Conecuh, Butler, Crenshaw County, Lowndes County, and so forth. Just significantly darker, in this case, Conecuh being the darkest here. All these counties, not only are they, like I continue to bring up, though, they're sending these workers, they're sending these people in and out of the Black Belt or in and out of these metro areas to come back, but also this is just major roadways through here. If we look over through Conecuh County, through Escambia, through Butler, this is just going to be I-65, one of the major interstates of Alabama. And then if you flip over to the other map, we're just going to see the same story, just a different time, where we see Tuscaloosa just being that little white shade. You know, it's a great population, but whenever these workers come back to their counties, there's probably 10,000 people in most of these counties, on average in most of these counties, and they go up to these higher populated areas and come back. 500 people in a town of 100,000 isn't anything, but whenever they come back to 500 people in a town of, or a county of 10,000, that's just going to make a bigger difference. It's going to be a darker color, and overall just make a greater impact on these areas. Because as we see again, though, on these borders, you see Perry and Hale County up there just outside Tuscaloosa. That's where most of these people are going to work or to school. And then you see down here with Lowndes County, a small little county, Crenshaw, going up to Montgomery, which is a lighter shade, still inside the Black Belt, but it's just a major hub and a major chance to spread.
I'll also just add that those really dark shaded counties at the top edge of the Black Belt right there, pre-vaccination, that's Lowndes, Hale, Greene, Perry. Those counties got vaccinated at a higher rate than most of the rest of the Black Belt. Like the Black Belt had pretty high vaccination rates overall, but those were some among the highest vaccinated counties. So it makes sense that after vaccinations were widely available, those death rates did go down. But in places like Conecuh, those were less vaccinated communities than the rest of the Black Belt.
And then also,
why is that?
Also on that case of just Lowndes and Crenshaw counties, Lowndes County, through the data that we were able to pull, there's one physician in Lowndes County to cover 9,974 residents. And I would say, luckily, like they're only 30 to 45 minutes away from Jackson Hospital, at least if you're sitting in the county seat in Haynesville, but like one doctor for 10,000 residents. Crenshaw County, you're looking at two physicians or one physician for every 6,900 residents. So that's 12,000 total residents for two doctors. And it's a lot harder to get to Montgomery or any of those hubs, those main hospital hubs that you think of whenever you're on these county roads out in Crenshaw County.
That's a good point. I'm going to pull this over to total deaths too, so it kind of gives a little bit of a wider view here. And again, we saw that 413 deaths per 100,000 people in the Black Belt counties. In the non-Black Belt counties, we saw 355 deaths per 100,000 people. And this just kind of illustrates that same thing. Again, this was maps that our own Ramsey Archibald made from this data that you provided in your report. And it's just interesting to kind of get the at a glance view, right? Now, Emily, you were talking a minute ago as well about those kind of counties that are outliers, the ones that are on the edges here. So I just wanted to ask you a little bit about how do we get more physicians to this area? How do we make this better? I know Garrett mentioned there was just one physician in Lowndes County, which is right next door to Montgomery. You would think that they would have a little bit more of healthcare access, a little bit more access to different providers. And then again, you look down at some of these Escambia County, you'd think that there would be more physicians there, more people wanting to work there. How do we fix this?
Well, one of the policy recommendations we make at the end of the COVID brief is to increase incentives for people to come and work here. And, that comes in the form of student loan forgiveness. We've got a lot of doctors that come out of med school with, really high student debt. And it doesn't always pay to be a professional in a really rural area where you do have fewer people. There's more poor people in the Black Belt. We know that all 19 of the persistent poverty counties in Alabama are in the Black Belt. The patients are going to have a harder time affording medical care. And that takes a toll on the feasibility of doctors that can work there. And so student loan forgiveness for healthcare professionals, whether that be nurses, doctors, any of those healthcare professionals, helping them pay off those loans in return for staying and working in the Black Belt for, maybe 5-10 years, depending on, what you want the terms of that to be, but, increasing those incentives and making it more feasible for people to go. And, we did talk to Miss Loretta Wilson at Hill Hospital, and she's from the Black Belt. She's working in the county that she grew up in. And she had gone away outside of the Black Belt for her college and grad school, and decided to come back to the Black Belt because she loved her community. And, that's where she felt like home, and she felt like she was called to work there. But that's not financially feasible for some people. And so making sure that people have the opportunity to come back and work in a community that they love, that they are connected to, is really important. And we can do that through student loan forgiveness and stuff like that.
And that is
Garrett,
where
how
we
do
really
we
come
fix it?
into that is just how we really come into a crossroads here with a lot of these policy implications and recommendations, because surely while we do see student loan forgiveness as probably the most ideal option, at least at this point in COVID, to bring healthcare professionals inside the Black Belt, as we've learned through a lot of our interviews and a lot of the data, COVID has shown us especially that a lot more is at stake than a paycheck. Whenever COVID first hit, and even months after, even a year after, we still see people quitting these jobs for their own safety, for the safety of their families, because we just didn't know. There's a lot at stake, and while if you want to get away from the side of it's not being about the paycheck, and we look over to the case of Miss Loretta Wilson, she is a rare case. She is there are a lot of people with a lot of sympathy and a lot of roots in the Black Belt, but the bulk of those people in the Black Belt that have this sort of sympathy, a lot of them aren't going to be able to go out, in the case of Miss Wilson, and go out and get these degrees and come back. It's a rare occasion. So sympathy and roots in the Black Belt will not keep the Black Belt alive. So there's a lot of implications about that, but by far the best way to keep the Black Belt healthy and educated would be to either implement this sort of student loan forgiveness, set up some sort of contract with these professionals to come in, pay off debts, offer housing or childcare is another huge one, or even a secondary option that we do point out is expanding broadband. As we mentioned previously, just the implementation of telehealth and just being able to expand that to people throughout the Black Belt, just be able to educate them on daily things, taking their vitamins, seeing that they get tested, make sure that they keep up with the protocols through telehealth, through expanded broadband access.
What will the Education Policy Center and again, the two of you who co-authored this report, what will you do with these suggestions? How will you get these implemented?
I guess I'll take that one. We're working on, this is part of a series. And so last week, no, the week before that, we had an issue brief on STEM education and access across Alabama, but focused in on the Black Belt again. Just today, we had another report come out on educational attainment in the Black Belt. And we've got a few more briefs to release in the coming weeks. And each of these briefs ends with policy recommendations. And, they target a specific policy area that each brief covers. But we want to, create a comprehensive collection of policy recommendations. And something that we're also going to follow up on this is, trying to get in touch with these legislators, community leaders, anybody who will listen, to get these policy recommendations in front of them, and just make sure that, they're aware and that there are options for lifting up the Black Belt.
because even aside from just mine and Emily's and another one of our co-authors, Sean's work here, aside from that, the Education Policy Center as a whole has been doing a lot more to reach out to a lot of these community leaders. I know that Emily can attest that we've been reaching out to a lot of county commissioners, a lot of local community leaders here these past few weeks for various reasons. So we're really trying to start. It's more of a definitely easier and definitely more plausible as a bottom-up approach. We're reaching out to these people on the ground and working our way up from there and getting attention that way. Getting attention through the great people at AL.com and these different news outlets. Just trying to bring the eyes onto the black belt, and the good eyes at least, not the eyes such as those the people from the UN who came to visit here a few years ago and saw the situation that we were in then.
I know that it sounds like you two and the whole Education Policy Center has its work cut out for them. But again, this is just very interesting information. And I know that you, again, Emily Grace mentioned, are releasing more reports that are focusing in on the Black Belt and on different issues. Where can people find those as they come out?
Yeah, they can find those on our website, which is edpolicy.ua.edu. We've got all of the reports linked there from this issue brief series, and they'll release on our website each week as they come out. And also, there are links to our Black Belt 2020 issue brief series as well as any of our other work, of course. And then also, as Garrett mentioned, Ramsey Archibald at AL.com has been dutifully reporting on our issue briefs since day one with Black Belt 2020. So your viewers and readers can find links to the briefs there. And yeah, I think that's it as far as where they can find them.
We will leave those links here in our story that Ramsey wrote about this specific report and those maps that he made as well. We're going to leave those linked here in the comments so people can read more about them and just kind of see what is going on in the Black Belt. I think we have sometimes this tendency to really only focus in the areas where we live, and we forget a little bit that there are 67 counties in Alabama, and there are issues that each one of those counties are facing. So again, Garrett Till, Emily Grace Corley, thank you so much for your just for this conversation, for educating us a little bit on what's happening down there and telling us what's next.
Thank you so much for having us.
Yes, thank you for having us.
Thank you, everybody watching. Thank you so much. We'll see you tomorrow.